Hi, Facebook, and thank you for joining me, Cassie Beisel, and the MRF for our first Facebook Live informational session on MRF advocacy and how you can influence policy. Before we jump in, I wanted to briefly go over who the MRF is and what the April 30 and 30 campaign is for anyone not familiar. The MRF is the largest independent organization devoted to melanoma. Its mission is to eradicate melanoma by accelerating medical research while educating and advocating for the melanoma community. As Advocacy Officer, my role is to lead the organization's advocacy efforts to mobilize advances in policy and federal funding while representing and engaging the interests of the melanoma community. I also focus on partnering with industry partners, such as pharmaceutical companies, seeking to amplify the voice of the melanoma community, as well as I co-chair for the National Council on Skin Cancer Prevention, their Skin Smart Campus initiative, ensuring that tanning beds are not on college campuses. And I'm also a member of the Public Access to Sunscreen Coalition, ensuring that everyone has availability to the sunscreen that they are going to wear. As a three-time cancer survivor, one of them being advanced melanoma, my goal is to work towards better outcomes and quality of life for patients, caregivers, survivors, thrivers, and their loved ones. Our April and April 30 campaign is determined not to let COVID-19 stop us from continuing our mission, the MRF's mission, to support our advocates, patients, caregivers, and survivors. To combat this, we launched an event called 30 in 30. This event is a month long of fun featuring virtual events that will bring our community together with the goal to raise $30,000 in 30 days to support 10 medical students, and in order to keep those medical students in the melanoma field. These funds will support research grants, again, for innovative medical students to help them advance the melanoma research field. Their research could absolutely lead to a future breakthrough and ultimately a cure for melanoma. We know at the MRF that this is a difficult time for many of our advocates, and we appreciate your support year-round. And in attending 30 in 30 events, if you can attend one of our wellness classes throughout the month, or if you can, please consider giving a gift, any size, to help fund student research grants, helping to keep researchers in the melanoma field, because melanoma hasn't stopped, we haven't stopped, and we won't stop doing these things for you to help you in these uncertain times. Cancer absolutely has no curve, and we are here for you. So let's talk a little bit about advocacy. First, let's address the elephant in the room. COVID is here. We've all had to change our way of lives. I want you to know that the MRF Advocacy Program is still working hard for you. Since Thursday, March 18th, the MRF has signed on to 7 letters led by our partners in advocacy. And as the situation evolves, we will be reviewing not only letters for our organization to support, but the entire melanoma community as well, ensuring access to innovative research, treatments, clinical trials, and minimizing financial toxicity. Let's talk now a little bit more about what the MRF Advocacy Program is. The MRF Advocacy Program convenes patients, caregivers, survivors, healthcare professionals, and like-minded advocacy partners to unite in one voice for the melanoma community. Issues range from increased government funding for research to access to care. MRF advocates play a critical role in the advancement of better outcomes for the over 1 million Americans living with melanoma and their loved ones. The MRF is proudly also a core member of several leading organizations that are dedicated to a future without melanoma. These organizations include the National Council for Skin Cancer Prevention and the Public Access to Sunscreen Coalition. I want to take a moment to tell you a little bit about the priorities that the MRF is focused on advocating for. Of course, many of you know that research is so important. Since 2011, there has been about 16 new innovative treatment options out there, and that is all due to research. And a lot of that research is funded by generous donors like yourselves. in the advocacy world, we go through funding from what is called the Congressionally Directed Medical Research Program. This gives us a line from the Department of Defense funding in order to find innovative research for melanoma. This also includes melanomas that are in our rare subtypes, ocular, mucosal, and pediatric melanomas. So funding for the peer-reviewed melanoma research program, or the PMRP, includes melanoma as an eligible cancer in the Department of Defense Appropriations Bill. Last year, we were only able to fund 11% of research proposals because of lack of funding from the Department of Defense. This left many highly rated proposals on the table. In hopes to find the best, most innovative research, we are asking the Department of Defense for $35 million for fiscal year 2021 funding. This research benefits, again, not only cutaneous research, but research for melanomas, rare subtypes, ocular, mucosal, and pediatric. We also support increase to the National Cancer Institute and National Institute of Health funding, and funding for CDC's, or Center of Disease Control, Skin Cancer Prevention Program. We also focus on prevention. We are currently setting up the infrastructure to work with Representative Kelly Cassidy, who successfully passed a no copay skin screenings in Illinois. The MRF is working closely to send letters to other states, encouraging them to do the same and work with us to make that happen. We work to increase the awareness of the dangers of tanning through increased prevalence of black box warnings within tanning salons and marketing materials. And we work with our partners to ensure that we are successfully having an under 18 ban for all states when it comes to tanning beds. We also work on access in many different ways. We work alongside of the SunUcate Coalition for access to sunscreen in schools. I am happy to announce that in March, Virginia was another state that was added to the list that has allowed children to bring sunscreen into schools. Many of you will ask, well, why can't a child bring sunscreen into schools? The answer is that it is a controlled product from the FDA, and it's listed under a class 1 drug, which is similar to that of an Advil or a Tylenol or any of the other drugs that you would get over the counter. So they would need a doctor's note. And again, allowing these sunscreen in schools allows children to bring it in, apply it to themselves without having a doctor's note. This is a big step in the world of prevention. As many of you know, you can get melanomas can start, from your very first sunburn, and they can start kind of growing from there. So this is a huge step in prevention and early prevention. We also go after access to safe and effective sunscreens as part of a comprehensive sun-safe regimen. We work alongside the National Council of Skin Cancer Prevention, the PASS Coalition, and the American Academy of Dermatology, the U.S. Surgeon General, and the FDA to ensure that the patient's voice is heard in this. Again, sunscreen is a very preventative tool in a toolbox to prevent yourself from skin cancers and the deadliest form, melanoma. We also work with access to healthcare with our partners like the American Cancer Society. We want to ensure that there is access to the treatments that are out there, to healthcare, and to standardization of treatments across the board, especially in our rare diseases who often lack that standard of care. So we work again closely with the American Cancer Society on that. And I just want to take a moment to say, if anybody has any questions, please feel free to message them in the box, and we will absolutely happy to answer them towards the end of this. So you may ask, how can I help to ensure that my lawmaker supports policies that impact those with melanoma? And there are many ways to do this. Being conscious of time, I will mention 3, but please visit melanoma.org to find out how to get involved in everything from our Miles to Melanoma events, our education symposiums, or to learn more about our advocacy efforts. So some of the ways that you can get involved is to visit the MRF's Advocacy Action Center at melanoma.org. Here you can email, call or tweet your lawmakers about the policies we are working on. It takes just under 5 minutes. The letters are pre-written, ready for you to add in your personal story and let them know that these things are important to you. You can also start local. Visit your local representatives and city officials and share your story and why having a sun-safe state is so important. You can also talk about access to healthcare, and I'm happy to work with anybody about those things. Please feel free to email me at advocacy@melanoma.org, and I'm happy to work with you on your state level and local level asks. And one of the more effective ways, and one of my favorite ways, is by attending our annual Advocacy Summit in Hill Day, which takes place every March. In fact, we just were able to have our Hill Day this past March before everything shut down, and it was a very empowering moment. For those of you who do not know what Hill Day is, it's a 2-day event in Washington, D.C., which unites melanoma advocates on Capitol Hill to meet with their members of Congress to urge them to make melanoma a national priority. Patients, caregivers, healthcare professionals, and community partners travel from across the country to share their stories and take their message to the Hill. And don't worry, experience with talking to members of Congress is not required for this event. The MRF will provide you with the tools, resources, and training you need to make your voice heard. Anyone who is passionate about telling their story and making a difference for the millions of Americans impacted by melanoma can attend this annual event. This past March, as I mentioned, we had over 70 advocates from 23 states who attended over 60 meetings, bringing their stories to the front doors of Congress. This resulted in over 26 signatures supporting defense-funded melanoma research. The ask is currently in the House of Appropriations Committee for approval, and once passed, we will need your help to get this passed in the Senate. If you have signed up for advocacy alerts, you will see this call to action shortly. If you have not, please take a minute to go to melanoma.org and pledge to act. From there, you will automatically be signed up to receive alerts and important advocacy calls to action that desperately need your support. And I know that we're coming up on time, but I wanted to see if we had any questions from anybody that we can answer. Just take a break for a moment to answer any questions live. Oh, I see one question now. Are there any webinars about advocacy? That is a great question. The Melanoma Research Foundation's Education Institute, which is on melanoma.org, hosts numerous webinars for people impacted by melanoma, as well as a few courses created to educate beginner advocates or those who need a refresh. We are constantly creating new content, so please check the site often for new educational experiences. I have another question that just came in. Thank you. The question is, if I missed Hill Day this year, are there other programs or events to get involved? That is also another great question. Absolutely. If you missed Hill Day this year, don't worry. Hill Day happens every March, and the MRF is always working on policy issues affecting the melanoma community. You can visit the Advocacy Action Center on the MRF's website to easily learn about the policies affecting the community and contact your lawmaker via email and Twitter, urging their support. And again, that only takes a few minutes to do that. Let's see, I think we have another question in. This is great, guys. Keep the questions coming. This one is, are there any pledges I can support? Absolutely. As I mentioned earlier, the MRF wants you to pledge to act in 2020. If you go online to melanoma.org and visit our Advocacy Action Center, just hit the button to say pledge now, and you will be included in receiving the most up-to-date news and legislation impacting the melanoma community and allowing you to email and tweet your lawmakers again in under 5 minutes. Do we have any other questions out there? Can give it a minute to come in. I see a typing bubble that's up there. While we wait, I just want to again say thank you to our amazing advocates who have been with us from the start and the ones who continue to join us in our great work that we do every year on the Hill. Without our advocates, without you, we couldn't be able to pass the bills we pass, ensuring access to healthcare, new innovative treatments, new innovative research. It's really important that we have you alongside of us in the fight. Advocacy works best in numbers. Oh, there's that question. The question is, where do I find who my state representative is? Again, another great question. You guys are killing it with great questions. If you want to find your state representatives, just go to melanoma.org and you will be able to look up who your state representative is in the Action Center. So that's an easy thing to do. You can also go to state.gov to look up your local representatives as well if you want to see who is on your council or your city. Again, advocacy is something that is easy to do if you take the time to learn. And again, we have a lot of courses on our website that go over civics if you need a refresher and you're many years out from high school like I am. It talks about basic government relations, how basic civics works. There's also an Advocacy 101 course that talks about how you can be an advocate and the tools you need in your toolbox to make change. Many of these policies only get passed because our advocates like yourselves go to the city halls, they go to Capitol Hill, through their mayor's office, and they share their story and tell them, because the majority of the time, our lawmakers don't know that these are happening, and the best advocate is you. As a stage 3 survivor myself, I am often finding myself going into offices, talking with representatives, even outside of my time of work, to talk to them about the many things that are happening, especially in my survivorship. And that's another thing. We are having a survivorship program that will be starting shortly as well. And that's going to be another great way to advocate. Do I have any more questions coming in here? Hill Day next year. So when is Hill Day next year? Hill Day next year is going to be in March. The reason we have it in March every year is because one of our largest acts goes to the Appropriations Committee for defense-funded melanoma research. Now in 2011, again, we had about 2 options available to folks who needed treatment for melanoma: interferon, interleukin-2, and occasionally people would use a traditional chemotherapy. However, since then, not only because of the Department of Defense funding, but funding from donors and advocates like yourselves, we have been able to get 16 new treatments. So because of that, we urge you to keep a lookout every year, stay active in our webpage. Join us on Hill Day next year. That will be generally sometime in the first 2 weeks of March. We'd love to have you. The more people we have, the better. The more stories we can share, the better, because we are all in this together. Any other questions out there? Nope. If I don't see any more, well, that's all I have for you for this edition of Advocacy, but I definitely look forward to doing more and seeing everyone back here. I wanted to thank everyone for taking time out of their day to spend it with the MRF and talk about the important issues impacting the melanoma community and how you can help. If you have any questions past this or you're looking to get involved, please reach out to me at advocacy@melanoma.org. And don't forget to please go onto our website, pledge to act to stay up to date on the important melanoma advocacy issues that are impacting the U.S. I hope everyone has a great day.